Upstate University Hospital is committed to preventing surgical site infections. Over the next few minutes, we'll show you the basic components of Upstate surgical scrub procedures. By following these simple steps, you will help us achieve our #1 goal of keeping patients safe and free of infection. For more information, please refer to the Department of Surgery's Blackboard site. Clean, freshly laundered, facility-approved OR scrubs should be donned each day in designated dressing areas. Long sleeves are not permitted under scrubs, and all hair, including facial hair and decorative head covers, must be completely covered. Jewelry must be secured, covered, or removed. Protective eyewear, masks, and/or face shields are mandatory and must be changed between cases. Booties must be used to cover your shoes, unless you have shoes that you wear exclusively in the OR. Fingernails should be kept short and rounded, and artificial nails or tips are not permitted. ID badges must be visible and attached using a clip that is easily cleaned with low-level disinfectant. You must be properly attired before entering the restricted areas of the OR. Restricted areas are found beyond the yellow line in both the 5E and 3N operating suites. Once you have donned the appropriate surgical attire, you can proceed to the scrub sinks, located in the sub-sterile areas outside each OR. At the sink, you will find 2 antiseptic agents, chlorhexidine and betadine, as well as the surgical brush sponge with nail cleaner. To begin, use the knee plate to turn the water on at the scrub sink. Open a brush sponge. Remove the nail cleaner and set the brush in the wrapper on the back of the sink. Next, wet your hands and arms. Make sure your OR attire remains dry during the entire scrub process. Dispense the chlorhexidine or betadine into the palm of your hand and make a lather. Under running water, use the nail cleaner to clean the spaces beneath the fingernails on each hand. Then discard the nail cleaner. Now moisten the scrub brush sponge under running water. Dispense antiseptic onto the sponge and work into a lather. Beginning at the fingertips of your non-dominant arm, use the brush side of the brush sponge to apply 30 full back and forth strokes. Make sure your hand is positioned so the fingertips are pointed outward toward the brush. Once the fingertips are completed, it's helpful to visualize your fingers, hands, and arms as each having 4 sides: right side, left side, top side, and bottom side. Beginning with the thumb on the same hand, perform 10 strokes with the brush on the top side of the thumb, then repeat on the right side of the thumb. Next, perform 10 strokes on the bottom side of the thumb. And finally, scrub the left side of the thumb. Now apply 10 strokes to the top of the webbed space between the thumb and index finger. Continue scrubbing each finger and interdigital space in the same fashion until all fingers on the hand are scrubbed. Moving on to the hand, start with the palm and apply 10 strokes to the palm of your hand. Then apply 10 strokes to each side of the hand, left, right, and top. When the hand is complete, move to the wrist. Use the sponge side of the surgical brush sponge to apply 10 strokes to each side of the wrist. Continue onto the forearm, and then up to the elbow. Always clean to unclean throughout the scrub. Next, rinse the brush sponge thoroughly. Then dispense additional antiseptic onto the brush and lather. Now begin at the fingertips of the other hand and apply 30 full back and forth strokes. Once the fingertips are complete, thoroughly repeat all steps of the surgical scrub on the other hand and arm. When the other arm is completed, discard the brush. Now, rinse the fingertips of the non-dominant arm, then the hand, and finally, the elbow. Make sure to keep your hand raised above the elbow so water flows from clean to unclean areas. Then repeat and rinse your other arm. Avoid contact with any unsterile space in or around the sink. Turn off the water at the sink. Keep the scrubbed areas in view by raising your hands above the elbows. Now, back into the OR. Once in the OR, dry your hands with a sterile towel before donning a sterile surgical gown and gloves. Once the full wet scrub has been performed, Avogard may be used before each OR case for the remainder of the day. Like the wet scrub, Avogard must be worked from the fingertips to the elbows and then reapplied to the hands before gowning. This concludes Upstate's basic surgical scrub procedure.